Hey.
Welcome back, doctor.
Good to see you.
You too, bro.
Thanks for doing this.
Of course. Thanks for having me.
Always
Okay.
a pleasure.
The pleasure's mine, sir. The pleasure's mine. Okay, so who are you? Tell us about you.
So I'm Dr. Max Muehleip. I am a chiropractor and a functional nutritionist, and I have my own practice here in Tigard, Oregon, which is a suburb of Portland.
Sweet. Awesome.
Yeah.
Awesome. And how long have you been doing this?
I've been a chiropractor since 2016 when I graduated, and then I've been a nutritionist since 2017 when I got my master's in that. So I've been out in the field for a while, but I started my own place in December of 2024. So this is all pretty new.
Wow. Wow, that's sweet. So what got you into medicine? Why did you decide to become a chiropractic care practitioner?
Great question. So as a kid, I kind of felt like I was always on a mission. Like I knew I wanted to be in healthcare. I didn't think I wanted to go the MD route. Not that that's necessarily bad. I just feel like medical doctors, they're kind of put into a box where it's like you can prescribe a drug or you can do surgery, and that's like it. So I didn't know if I wanted to go that route, but I knew I wanted to be involved in healthcare. And as a kid, I was lucky enough to be seen by some chiropractors. When my mom was giving birth to me, she threw her back out, and it was so bad she couldn't even hold me. And
Oh, wow.
my uncle Randy, who was a dentist, told my mom, just go see my friend Dr. Burbach, he's a chiropractor. Just what could it hurt? Because my mom was like, I don't know, aren't chiropractors quacks? And after 2 or 3 treatments, my mom was fine. She was able to hold me. So when my sister and I were growing up, we were lucky enough to go and get regular chiropractic care.
Whoa, that's interesting. I'm actually glad that you brought that up because that kind of sparked another question for me because I've heard the same thing. A lot of times when I hear people talk about chiropractors, I've heard people say, oh, 1 in every 25,000 adjustments ends in like an injury of some sort. And so maybe this is like a great spot to ask the question, like what specifically does chiropractic care do? And like what is the science behind it that maybe most people don't know? Because many people might think you're just cracking the air bubbles out of people's joints or skeleton, whatever the term might be, and they're less aware of the scientific and medical benefit that's validated throughout history and throughout many studies. So what exactly does that look like? If you were to explain it in basic terms to someone,
Sure.
what is the benefit of it?
Great question. So right off the bat, I would say you actually understand more of it than even like the typical layperson. People think I'm like literally snapping, cracking bones and joints, which isn't true. We're moving the joints around. So when I assess a person's body and I feel something's like either in the wrong position or in areas restricted and it's not moving the way it needs to, when we adjust a joint and you get that cavitation, that popping sound, which is the gas inside the joint moving.
That was good.
You're stimulating what we call mechanoreceptors in the muscle spindles and the ligaments around there. Basically, are you familiar with the term proprioception?
Yeah, it's our awareness of where we are in space and things like that, right?
Yeah, where the body is positioned in space. So that cavitation stimulates a lot of proprioceptors, which sends a bunch of signals up to your brain. So your central nervous system, your brain, suddenly gets all this information about where the joint is in space and all the tissues and muscles around it. So that can help to bring the body back into a balance or homeostasis. When that happens, it will calm down muscles that are really tight and in spasm, and it'll wake up muscles that have fallen asleep. So it kind of helps to bring things back to center. So what we're really doing is we're stimulating all those proprioceptors, giving the brain a lot of information to work with. Also, what's kind of neat is there is a slight release of painkillers when the body does that too. Now, the thing that I also like to preface with that is not every joint is going to have that pop cavitation sound. Some joints physically can't. And not every adjustment needs to have the joint move like that. Sometimes it feels nice, but I tell people don't get addicted to the crack sound.
That's so funny. That's dope. I like that. Sweet. And where did you study? Like, how long did it take you to get a degree, and what was that process like for you?
It's similar to a lot of other medical schools. I had to do all the prerequisites in undergrad, do the pre-med track. I had to take a bunch of exams to show that I was ready to go to medical school. I got into a variety of different schools. Palmer in Iowa, National in Illinois, Life West in California, and then University of Western States here in Portland, Oregon. And I ended up going with UWS here in Oregon because the academic program was really rigorous. They got really good board exam scores for a lot of their doctors, and they had a bunch of other master's programs at the time, one being in human nutrition and functional medicine, which really appealed to me because I kind of wanted to do both. I think in another life I would have been a naturopathic doctor, but I grew up being around chiropractors and got to see the miraculous things happen with that all the time, so that really appealed to me. So I was in school for 4 very grueling years. Medical school will break you down and build you back up piece by piece. So that was really intense, I will say. And we would rate the weeks on how difficult the week was going to be based on how many exams we had that week. They're like, oh, we only have 3 exams this week? That's not so bad, that's fine. 5, middle, 7 or more, pretty intense week. But my 5th quarter in school, we actually had 30 credits. Typical course load is 16 at an undergrad program.
Jeez.
So yeah, medical school, it's intense. So 4 years of that. At the end of that, I had a couple opportunities to work in some clinics downtown. One Inside Out, which is a clinic for people that either don't have any money or can pay very little. So I worked with a lot of people who didn't have homes, people who might be between homes, a lot of things like that. Like I would go there in the morning and there'd be people sleeping outside, and I'd show up with McDonald's coffee because, you know, they were probably up all night, and if I woke them up, they might come out swinging at me.
Oh, wow.
You know, people that really, really need the help.
Totally, totally.
Then I worked at the Women's VOA for a while, which is sort of a halfway house for ladies who are trying to get clean. That was really cool. Just really a great experience getting to work with people who, you know, need the care more than almost anyone else.
That's sweet. That's sweet. The community work.
Yeah, absolutely.
It's important. That's sweet. That's dope. Okay, so what were some of your personal health concerns when you were growing up? What inspired you to get into this field of study?
Well, people never go into medical school for no reason. And for me, like many other doctors, there was a lot of personal investment in there. As a kid, I was really sick a lot. Colds, flus, constant runny nose. I was allergic to everything, pollen, dander from animals. I had really bad exercise-induced asthma, so just running around playing on the playground with my friends would give me an asthma attack. Made running or doing any sports really difficult. And, you know, hindsight is 20/20. And this was in the 90s, but even back then, we didn't know nearly as much as we know now. So I think a lot of it was growing up in an environment with a lot of pollution in the air. I grew up in the Chicagoland area. I remember coming across the smell and feeling really nostalgic, like, oh, this reminds me of growing up in Chicago. And my friend was like, yeah, that's diesel fumes, dude.
That's exactly how California is.
Sure. Yeah, exactly.
Same thing.
I had a lot of fast food as a kid. Tons and tons of fast food, lots of candy, lots of really processed junk, which, you know, I know now is related to my asthma, my digestion, the fact that I was constantly sick, the fact that I was allergic to everything. My immune system was getting no support and was being bombarded with all of this processed junk, lots of sugars, artificial dyes, lots of salt, lots of fat, and very little nutritional value in these things. So after 5th grade, we left Chicago, we moved out to rural Wisconsin to be closer to my extended family. And there, even just being out of the polluted air, my asthma cleared up. Because, you know, I was still eating a lot of junk at that time. But the asthma went away. I wasn't sick nearly as often. The big thing was the allergies. Suddenly, I didn't have any allergies anymore. Food, though, continued to be an issue for me for a long time. Always eating lots of burgers, pizza, French fries, candy. And as a teenager, I had really bad cystic acne. So bad that I had to take Accutane for it, which is such an intense drug that they say, like, do not have any babies when you're on Accutane. It will give them birth defects.
Yeah,
kind of drug.
totally.
And it worked for me, and it dried the heck out of my skin. Like, I could feel my joints felt dry while I was on it, but it worked. Yeah, it really wasn't until I got serious about my health and nutrition in college and medical school that my skin cleared up, my blood pressure lowered, I wasn't sick all the time, and I finally did some digestive testing, and found out that I wasn't celiac, but I was gluten intolerant, dairy intolerant. I can't have pecans, and there were all sorts of other foods that were flaring up my system. I had to do an elimination diet. I had to do a candida yeast protocol to clear that out, and that was a good long while. I'd say 6 months to a year of eliminating those foods and then slowly introducing most of them. Now I can have just about anything, but I think because of the almost 30 years of damage of eating gluten and all these processed foods, I still can't have gluten, dairy, and I haven't really tried pecans. I'm going to get some updated testing soon, but that's not a big issue for me.
You know, the old classic updated test is just put them right in here, you know?
You know, that's true. I could just put one under my tongue and see if like my pulse changes. But yeah.
That's dope. That's sweet. So you had an upbringing where you had a lot of personal struggles and then you overcame them. And now it seems like you want to share that with the world.
Absolutely. My mission is to help teach people these practical ways to live a fuller, healthier life, because I've seen chiropractic care do some miraculous things. I've seen nutrition and lifestyle care do some really miraculous things. And, you know, this is all natural stuff that's easy to get your hands on. You don't have to wait 6 months to see a specialist. You don't have to go on, well, some people don't have to go on really expensive, crazy drugs, prescriptions to manage their symptoms. And oftentimes with some chronic conditions, that's all that prescriptions can really do is help you manage them. Until you take ownership for yourself and empower yourself to change your diet and change your lifestyle, you know, there's only so much the mainstream medical model can do for you.
It's very true. You know, that's one of the reasons why I really appreciate and respect what you do. And I want to piggyback off of what you were saying about seeing a lot of miraculous healing from nutrition and chiropractic care, because I've seen so many amazing changes. In fact, all the permanent changes I've ever seen in anyone's health have always come from lifestyle changes. So can you tell us a couple stories of miraculous things that you've seen by changing people's diet or practices that have helped their body in general? Like, what comes to mind when you think miracle healing that you've actually seen and witnessed?
Okay, a great question. I'm going to back up a little bit because you asked about like what inspired me to be a chiropractor. I was lucky enough to see chiropractic do some really amazing, I would call miraculous things growing up. One was for my Uncle Bob. His wife had twins, and one of the twins was born with torticollis, where their neck is twisted off to the side like that. Because I imagine, you know, the twins, they were just really squished in the womb because there's two babies growing in there. So took the baby to the doctor, and the doctor's like, well, you know, we could do surgery to sever this muscle so she could sit upright, but she'd never be able to turn her head.
Oh.
So my mom and my uncle, the dentist, Randy, managed to convince my Uncle Bob's wife, Amy, to take her into the chiropractor. And working with the chiropractor, baby's just fine. And the torticollis resolved like that.
Wow.
The other thing was when I was in high school, my mom got really bad sciatica, which is like shooting nerve pain down the back of the leg, like electricity, like someone sticking you with a hot poker.
Yeah.
So bad that she couldn't really get out of bed. At the same time, she also got really bad pneumonia and was just coughing and hacking, and that would flare up the sciatica, and then she wasn't sleeping, so the pneumonia was awful. And as a teenager, I thought my mom was going to die. You know, she couldn't get out of bed. But she went to work with her chiropractor, who put her on a treatment plan, seeing her a few times every week. And slowly but surely, that sciatic pain started to calm down and resolve. And she stabilized and got to the point where she was, you know, walking miles out in the country every day. And to this day, that sciatica has never come back.
That's right. That's dope. My mom has actually dealt with the same thing for a while, but she hasn't taken any protocols to resolve it. So that makes sense, because a lot of people, when they think about stuff like that, they assume permanence of injury or permanence of illness. So it's great to hear about stories where people have actually resolved things and have permanently put it into remission, you know, if that's the right word that you want to use.
Yeah, I mean, like that sort of long-term remission is functionally what we call curing it. You know, in medicine,
Bingo.
Yeah, we hesitate from saying the word cure, right?
Yeah.
But that long-term remission, what's the difference there between curing something and just not having it come back. So I would encourage your mom to, go check out a chiropractor or a PT, at least do a consult. See what they might save to her.
Well, there's one right here.
Yeah, send her my way. I'd be happy to evaluate her.
I'll have to refer her actually to you. So
So then you wanted some more miraculous stories. I wanted to share a few from my own practice.
Okay.
Since I've been in school. So chiropractic school, medical school, breaks you down, builds you back up brick by brick. I grew up seeing chiropractic do a lot of miraculous things. And then you go to medical school and you get all of that, the miracles beaten out of you, right? It's like, what can we prove with a scientific study? If we can't prove that, does it exist? That gets all beaten out of you. Then, of course, you get into practice and you're working with people all the time and you see amazing things happen. I'd say at least a couple times a week, something pretty miraculous happens in clinic working with people.
Mm-hmm.
This was so cool. This was my first job. This woman came in with her dad. She was in a wheelchair.
Mm-hmm.
Debilitating back pain.
Mm-hmm.
Did an exam, took some x-rays in office, and was like, oh yeah, I think you have some nerves that are pinched in the very base of your spine.
Mm-hmm.
Like when you look at an x-ray of the low back, you can see the holes between the vertebrae pretty clearly. That's where the nerves come out.
Mm-hmm.
And in her, I guess from wear and tear over decades, there was just almost nothing there. It's like, well, no wonder you have back pain. These nerves are on fire. They're just being compressed and irritated constantly.
Yeah.
So we did some traction on her back very gently to try and decompress things.
Mm-hmm.
She was very tender and very sore, so I had to be very gentle and specific with my treatment. But I adjusted her low back, and she got off the table and walked out the door.
Wow.
That's
crazy.
A good day.
That's dope. So miracles that happen on a regular basis.
Mm-hmm.
The product of chiropractic care.
Mm-hmm.
That's sweet. Okay, sweet. So for you personally, what was the turning point that made you want to improve your health?
At some point, you kind of just get sick and tired of being sick and tired. As a kid, I was allergic to everything and had really bad asthma. I couldn't run around and play with my friends. I was just ill all the time, constantly running nose. And eventually you either decide you're going to do something about it and take care of yourself, or you kind of just give in, right?
Mm-hmm.
And for me, giving in isn't really an option. I had to muster within myself that desire, I am going to take ownership of this. I'm going to figure out what's going on, and I'm going to get it better because I can't live like this. Mm-hmm. And, I want to be able to run out and play with my friends. I want to be able to go to the park and play soccer and baseball with my kids. I want to be around for when my 7, 4, and 1-year-old have children of their own. And what you have to do is start taking care of yourself.
That's sweet. I agree, honestly. That's one of the hardest things to do in the modern world sometimes also, when it feels like there's so many things leaning on us and pushing up against us, and there's so many maybe obstacles to maintaining health that maybe weren't there just 100 years ago. Do you remember a specific day where you just felt like an absolute rock bottom moment, where you felt that you were at your lowest? Was there a specific day, a week, a time of your life where you hit your wit's end and you decided that you had to change?
Hard to say for me, to be honest. I started making some of these changes younger than probably a lot of people do. This was middle school for me. I remember being really sick when I was 11 and 12 and making some drastic changes, starting to exercise a lot more. Coincidentally, this also happened to be when we moved out of the city into the country, so I wasn't just inundated with pollution constantly. Mm-hmm. Yeah, I guess for me there was no one defining moment, but probably death by 1,000 paper cuts.
Yeah.
A lot of little things over time.
A lot of small amounts of pain accumulating.
Yeah, but something more to the point that you brought up just a second ago, modern life is stressful. It beats you down. Our world is toxic, right? There's all sorts of heavy metals, pesticides, chemicals on our food, in our water, in the air we breathe. We're just inundated with it. Even electronically, if you want to get into the whole dopamine addiction of smartphones and social media.
Yeah.
But that's something that I really focus on. My whole tagline is teaching these practical ways to live a fuller, healthier life. Because the advice I give is simple and practical. And I'm there to help coach and motivate people through it. But the onus eventually is to empower my patients to take care of themselves.
That's sweet. That's dope. Speaking of the technological era, this is like a minor question, but people always say the word tech neck.
Yeah.
Do you actually see that now? Have you like been able to help people reverse it? Have you seen them reverse it by doing some exercises? Like what's the doctor's take on that?
Oh, absolutely. Tech neck, that's something I see a lot more with my younger people. I probably even have a bit of it going on right now because I've just been at the desk doing charts for a few hours. But say like I'll go to the gym, and even with the young men and women that are in their teens, you can tell by the clothes and their hairstyles, they're Gen Z or Gen Alpha, and even on the equipment, they always have their necks craned forward like that, and I can tell it's because they're just looking at their phones all the time. So. What I really want to do is go over and just like correct their neck form. But yeah, you can do a lot to help retrain that. What we find a lot with those cases is people develop what's called upper crossed syndrome, where there's a combination of muscles that get tight and muscles that get weak, and they sort of form this cross up here. So a lot of people will hunch forward. So the pectorals and the neck and upper back will get tight and stiff, and the muscles between the shoulder blades and the muscles right here will get weak. So it's about not only opening up the muscles that are tight, but helping to retrain and strengthen those muscles that get weak.
That's interesting, yeah, because sometimes I notice that I slouch, and as I look in the mirror, I'll literally notice that my shoulders are like rolled forward. And actually, recently, as I've been becoming more aware of my body, I'll roll them back intentionally, but I'll actually notice the tone of the muscles is like set in this position. So I've been really trying to correct that because, yeah, I feel like I've been on my phone too much, and I record a lot of music, so I'll sit down in front of a computer frequently, and I'll catch myself in that position. So thanks for answering that.
So
Okay, so how long did it take for you to notice a change in your symptoms? Once you started to change your lifestyle and make some improvements, how long was that turnover period?
I'd say you notice pretty quickly. It depends on the degree of change, right? Like if you can make a drastic change, you'll feel a difference, I'd say, in about 3 weeks.
Oh, wow.
If it's a chiropractic problem, you'll probably feel a difference right away. But in terms of resolving inflammation and a problem, 3 to 4 weeks.
Okay, sweet.
For chronic issues, like if I have a patient come in and they're like, I'm type 2 diabetic, help me get off, insulin and metformin. Like, we can work together, but I'm probably going to have to work with you for a while, 6 to 8 months when we're talking about a chronic issue.
Totally, especially because a lot of times people have had so many years of usage of pharmaceutical, prescription drugs, and then there's lifestyle things and habits that probably need to be reversed and changed. Which I would guess, I'm interested in your perspective on this, but I would guess that a lot of times that's the hardest thing with some patients is to get them to give up those vices, the drinking, the sugar, certain drugs, maybe alcohol, or a sedentary lifestyle. What have you noticed when you're looking at people or helping patients that have a lot of these overlapping habits? Have you noticed any specific things that have helped them? Do you notice that sometimes that's hard for them to kind of kick? What's your experience in that area?
Oh, yeah. First of all, I work with people that are motivated and ready to change. I've developed really comprehensive programs and all this stuff bent over backwards for people who are not ready to change and take ownership of their own health. And those cases never end well. So you have to be ready. You have to be motivated, at least to try something for a short term. So some of my patients, like take someone with inflammatory bowel disease, Crohn's and colitis, what they really want is their freedom back and their sense of security back, because they've lost all sense of what they can eat, what they can't, because it's giving them like bloody stool and like nothing works, and they've been traumatized.
Yeah.
So ultimately, what they want is they want their freedom back. So if I can say to them, like, look, I want you to do this elimination diet with me for 21 days, and we'll see how you do, right? Usually that's enough to get people on board, especially if you can incorporate things that they already like to do, foods that they already like to eat. Even if it's just a healthier version of it, that's a lot more appealing. So I try to meet the person where they're at, but they definitely need to be motivated. I also say that people expect progress and change, especially with these sorts of things, to go like this, right? Like you start and it gets better and better and better and better. That's not really how life works. You know, you'll try something, it'll work, you'll feel better, you may fall off the wagon, or you'll have too many celebration meals, go out to McDonald's too many times. Progress really, I think, it looks like a corkscrew where you improve and then you relapse a little bit, and you improve and you relapse. But the important thing is that you've got that forward momentum. You're going up over time. So another important thing is to track your progress over time, see how we're doing. Because after a while, you've been doing something for a few months, you may be doing a lot better than you even realize, because you're in your body all day, every day. But if we can track your symptoms and see how you're doing over time, we can show you like, look, when you started, you know, you scored 50 out of 100 on this thing. And after we working together and you're feeling better, now when we check, you're 12 out of 100.
So just the incremental progression, like little by little over time, is kind of one of the things that you've noticed is almost fundamental to healing and change and growth.
That's life.
Totally, totally. I like what you said about working with people who want to change already, because I want to say it was Hippocrates that said, before you embark on a mission to help a man heal, first ask him if he's willing to give up that which made him sick in the first place.
Absolutely.
So, that's great. That's really important. Sweet. Well, okay. So how do you feel now? What sort of changes have you made in your daily life to maintain your health and your energy? And have they impacted your ability to live and embark on your personal mission? Do you feel reinvigorated? Where are you today?
Great question. So my personal mission, again, is to teach practical ways of living a fuller, healthier life. I always envision myself as the perennial student. I always want to learn. I always want to take in more, so I can give more back to people. I always want to be teaching them things that they can apply to their life now, things that are practical. So for me, you know, I could go out and have gluten right now because my gut's, you know, largely healed. I just choose not to because I know that gluten is a poison. And so I've eliminated that from my life. That's just not part of my lifestyle anymore. I was listening to a speaker recently who I thought really articulated this idea well. It's like, talk to somebody who's vegan, right? And I'll work with somebody who's on any diet, you know, plant-based, animal-based, whatever. My goal is to try and help you achieve your health goals. But people who are vegan, they don't approach it from like, oh, this is my diet and I'm chained to this diet forever. No, that's their lifestyle. That's their mission. That's who they are.
Yeah, it's their identity often.
Exactly.
Yeah, yeah.
So for me, that's me. I have a gluten-free like lifestyle identity. Because here's the thing a lot of people don't know. Even if you're not celiac, even if you're not gluten intolerant, that protein interacts with your digestion and it causes holes in between the cells of your intestines. So even if you have no problem at all with gluten, eat bread every day, it's still causing holes in your intestines, which can lead to holes in the blood-brain barrier, which can lead to greater infections, greater risk of things like autoimmune disease. So for me, that's all in the past. I'm a gluten-free guy.
My man. The doc, he's a GF. Okay, so what is a typical treatment with you like? Like from your perspective, how does that usually go?
So a new patient appointment, there's a lot of intake paperwork. I'm going to get a really thorough history of, you know, where you're at, where you've been, all the things you've dealt with, surgeries, drugs, allergies. I'm going to do a few questionnaires to determine some lifestyle things. How is your sleep? Do you have poor sleep hygiene? Are you living a really toxic lifestyle exposed to a lot of heavy metals, chemicals? Do you drink a lot? Do you smoke? I want to know all of these different lifestyle factors, everything that's influencing who you are, so then I can see the picture of the person, the puzzle that comes in as a new patient to see where they're at. Because 9 times out of 10, if you have a really good history and you get all that background information, you'll know what they're dealing with before you even really have to examine them. They'll tell you the diagnosis 9 times out of 10. The trick is to listen. A lot of people that come to me, they say, "You're the first doctor who has ever actually listened to me," right? We have Kaiser insurance through my wife's job, and that's great for the occasional wellness visit if I want to get some labs or if kids need antibiotics or something. But those doctors, they only get 10 to 15 minutes with each patient, right?
Yeah.
It's just boom, boom, boom. No matter how well-intentioned, that's just not enough time to get a good picture of where a person's at.
Yeah.
So that I get all this background information. We go into the exam, and there's kind of 3 parts. I'm going to check nerves, reflexes, things like that, do my orthopedics, do my chiropractic exam, see how things are set, the differences in the tone, the texture, the temperature of their tissue. If they have any lab work or imaging, that's really helpful as well. It gives me another picture. I'm personally a proponent of applied kinesiology, which is a type of muscle testing to check what we call viscerosomatic reflexes, so reflexes coming from the organs inside the body and how they affect the body outside. So the way I like to explain this to people is, say if someone has a heart attack, they'll feel it in their chest and their arm because the nerves that go to the heart also go to that area of the skin. So if I'm checking someone's muscle, like the anterior deltoid here on the shoulder, pushing down, like, yep, your brain and your body are making that connection because you can meet my resistance. So we know that your nervous system is connecting properly. If all I have to do is touch that area, maybe flick it, and that's enough that your nervous system says, "Oh, I don't like that," makes it go weak, we know that organ's in trouble. Does that make sense?
Yeah, yeah.
So I'm always going to pair that with the patient's history, with the questionnaires they fill out, with their labs, with their imaging, if they had an EKG, heart rate variability, whatever, all these different tools to put it together to give me the diagnosis. That helps me determine what supplements are going to be effective for them, what sort of dietary interventions, what sort of exercises I can do for them, even what type of manual therapy I can do. A lot of times patients will come in, they're so sore, everything hurts, everything's really tight and spastic, and sometimes it's as simple as, well, you don't drink enough water. Or if you drink water, are you getting water with some electrolytes in it, some salt? Because we need those salts and minerals to move our muscles.
Totally. They're drinking water, but they're not hydrated.
Yeah, absolutely. And so things like that can be step number 0, right?
Totally.
So my new patient appointment's about an hour. Usually people fill their stuff out before, so that gives us enough time to go through their history, do the questionnaires, do my exam, and then if indicated, sometimes we can get a treatment in right there.
Wow.
Otherwise, I might be sending them out for more labs or some imaging, and then they come back in and we can get a better idea of how to move forward and develop a treatment plan that'll be catered to them and their needs and actually get them the results they want.
Well, sweet. That's dope. So what do you feel is unique or different about your approach to chiropractic and nutrition care? What makes you special?
Well, I'm the best. No. I think what makes me unique is that I do have that training in human nutrition and functional medicine. And at this point, I've had a lot of clinical experience. I've been lucky enough to work in a variety of different clinics. My first job was in a high-volume chiropractic clinic where I was treating a lot of patients each week. So I got really good at adjusting, got really good at those manual therapies, those physiotherapies, got really good at taking x-rays. Then when the pandemic started, myself and a naturopath, Dr. Saba Juveri, who's now up in the Seattle area, we took over for this doctor that retired after 42 years of practice. So we worked together in this integrated clinic. My bosses at the time also hired a nurse practitioner, and one of the clinic owners was a medical doctor. So it really was integrated, all sorts of different doctors and perspectives and treatments. So I really think that I have a wide breadth of experience. Also having a wife who had 3 kids, grew and gave birth to 3 children. I've had a lot of experience working with everybody from pediatrics to geriatrics, and babies all the way up to, end of life care. Youngest patient I ever worked on was my son, who was 10 minutes old. Came out of the birth canal, and they're still made out of Jell-O. All their skull bones are still kind of floating in the skull. And I could feel that his two parietal bones back here, one of them was laying over top of the other one.
Mm-hmm.
And babies, they're so easy to work with because everything's still made out of jello.
Yeah, yeah.
So I remember just applying the slight amount of pressure to his head, and the bone just went snap back into place.
Wow.
Yeah, very cool.
So what do you think may have happened if you didn't do that then and there? Do you think it still could have been treated later on? If it wasn't treated and it settled that way, do you think it could have kind of developmentally caused like a weird rift? Or what do you think might have happened?
Good question. There's no real way to know for sure, but the position of the skull bones and how the brain grows, especially at that age, everything's growing so quickly. You're making so many new neurons, so many new connections and synapses that I could only imagine having those bones not laid over top of each other, not providing additional pressure, just allowed blood and lymph to circulate more evenly and more easily. And when you take that tension out of the nervous system, when things are more in an optimal position, they're not tight, they're not in spasm, they're not asleep, for lack of a better word, hypotonic, where the muscles aren't firing actively, then everything functions more easily. I got to work with another young baby who was, I think he was just a couple weeks old at this point. His parents brought him in. He was asleep, taking a nap in his little car seat. So I just picked him up. And because babies are so easy to adjust, it's just like finger blanch pressure, like just enough to blanch your fingernail. You can feel the joints move because they're still made out of jello. I just worked my way up from the base of his spine over 10 to 15 minutes up to the base of the skull, and you could just feel his nervous system unwind as we went. And still asleep, so I just set him right back in his chair.
Wow.
But I can say, from having worked with a lot of kids now, they get knocked around, they roughhouse, they fall off of things all the time. Getting things back into an optimal position, getting that nervous system interference out of the body helps with a variety of different things. I've had patients tell me that their children's digestion really improves after an adjustment. I've had patients tell me that their baby's colic really improved after doing an adjustment. And I'm not saying that was the causative factor, but it was definitely helpful by calming down nervous system influence.
Wow. That's incredible. That's sweet. So tell us about your plans for the future. You just started your own clinic. What's the next thing on your plate? What's the next part of your vision?
Well, the thing I'm really excited about right now, and we're just launching ads this week on Instagram and Facebook, is I have this program for patients with inflammatory bowel disease, Crohn's and colitis, and people with IBS as well, but more specifically, inflammatory bowel disease, IBD. When I was in my nutrition master's, I did my whole capstone thesis project on the effects of vitamin D in inflammatory bowel disease, Crohn's and colitis, and how incredibly helpful that is. Vitamin D actually goes into the white blood cells, the ones that are causing all this inflammation and causing destruction of the gut, and they basically power them down. Pretty
With that
remarkable
sound effect?
That's exactly. That's what happens in the body. You can listen to it under a microscope. No, but that's just really incredible to me, and very excited about that. I've had some success working with a few patients now to improve their ulcerative colitis. A really cool example of the success of this was this one woman I actually just saw last week who was getting like 8 to 10 bloody bowel movements a day. She constantly had to know where the bathroom was because anytime she could just go. And that made it really hard for her because she's retired and she goes to all these sports games to watch her grandkids play all the time, all over the area. Working with me, now she's down to 1 normal bowel movement a day.
Wow.
And she can eat a whole bunch of food she didn't before. Now she can have, pizza and cheeseburgers and it doesn't flare her up anymore.
Wow.
Pretty awesome stuff.
My man, that's miraculous. That's pretty sweet. Sweet. And so this is a question I'm always really interested in asking practitioners, and I'm always really into the avant-garde approach to learning, which is academic in the school of life, not necessarily in any major institution or any tethered to any degree. But what have you learned? What are some things that you learned through experience that you weren't taught in school? What are some big life lessons that you learned or experienced that have added to your academic career?
One is to be open to the unknown and to be open to those miraculous things happening. Like I was saying earlier, in medical school, they beat a lot of that wonder out of you because they want you to become very clinical, very science-oriented, right? You've got to have that differential diagnosis in your head. What are the most likely things? What is my next step? How can I prove this thing is happening? And I went into medical school because I saw miraculous things happen in my life and for people in my life growing up. And coming back into practice, you start to see those really amazing things happen on a regular basis. Sometimes it's hard to explain. I remember giving this woman her first ever adjustment. She was in her 50s, came in with neck pain, and I adjusted her neck, and the neck pain was all resolved, but then she claimed that she could see better afterwards, and that wasn't something I was working on.
Yeah.
I'd say that's pretty miraculous, someone who's in their 50s to suddenly be able to see better.
Totally.
Or that woman who came in a wheelchair, and an hour later, she walked out the door.
Yeah.
You have to be open to those sorts of things. And that is the kind of stuff that really means a lot to you as a doctor, because we all come into this wanting to help people. And you really have to hold on to those, because those are the things that remind you, like, yes, this is my mission. This is why I'm doing what I do.
Totally. Totally. Those are like the big light bulb moments,
Mm-hmm.
the ones that really cause an impact in the memory and the quality of your life over time.
Oh, and I'd also say, running the business side of things. Medical school teaches you a lot about how to treat people, but not much about having to run your own business. So I'm very grateful that I got to work in some clinics that were run by people who knew what they were doing.
Totally, totally. The life skills, they are developed outside of the books.
That's right.
In the streets, if you want to say that.
That's one more thing I want to touch on is that whole idea. People don't care how much you know until they know how much you care. So, I have all this educated intelligence and all these ideas and things that will probably help people. But people are coming into me in pain. They're traumatized. They don't know what to do. They don't know what to eat. And really, you have to be able to listen to them, to hear their concerns, and figure out what it is that they actually want. Like those people with inflammatory bowel disease, Crohn's and colitis, they want control back over their life. They want to be able to eat food and not have this existential dread that what they're eating is going to cause permanent damage.
Yeah.
Especially if their family's eating all this stuff and they're not having any problems.
Totally, absolutely. There's many notes to the chord of treating someone, it seems like, and some of those human elements, some people are born with them or develop them, but all doctors or practitioners must be aware of them and eventually focus on them, because what you're saying is really important. Some people, even if you give them the right protocol or the right amount of steps to take to recover, if they don't feel like you see them or you hear them, they're going to be less likely to trust you and then follow through on that. And then they're less likely to just recover and heal in general. So it's an inside and outside type of job.
Mm-hmm.
Sweet. So this is a really big one too for the people who kind of are into like free medicine or free like self-care. But what preventative practices can people implement to avoid coming to a clinic overall? Like, how do people avoid coming to see you? What's going to keep them out of a wheelchair and out of your office?
Sure. Great question. First thing, ditch the standard American westernized diet, really high processed diet. Get more real foods into your diet. Fats that haven't been highly processed, so get rid of the canola oil, get rid of the corn oil. Eat oils that come from real plants that haven't been like heated to 1,000,000 degrees. Coconuts, olives, tallow, ghee. Eat animal proteins from animals that have been treated well. Feedlot corn or feedlot beef with all that junk in it is not going to treat you very well. So that get those inflammatory foods out of your diet and you'll save yourself so much pain and heartache. The number one killers in America: heart disease, diabetes, cancer. When you eat an anti-inflammatory diet, you dramatically reduce your risk of all of those major killers. The second thing is you've got to move your body. I know in the modern world, we all work at a desk, we all work at a computer. You've got to get up and physically move your body. And the bright side of that is it doesn't have to mean killing it at the gym every day. That's all gravy if you want to do that. And for a lot of my patients, I do recommend doing a resistance exercise at least twice a week to build up muscle mass, because that's where your metabolism is your muscles. But even low impact Pilates can dramatically extend lifespan in people. There was this fascinating study just came out of England, because they have all this data on people within the national health there. They were able to really parse out what sort of interventions have been helpful for people. And what they found is that people who exercise at least twice a week for 2 years will extend their lifespan 3 or 4 months.
Wow.
So you got to get your body moving.
Wow.
The last thing I would say is to sweat or perspire on a regular basis, because our body takes in toxic junk all day, and you got to be able to get it out in the stool, in the urine, when you breathe out. But you also have to sweat and perspire. That'll help with your circulation. It'll help with your lymph, and keep your body younger.
Sweet. Awesome. So work out, sweat, and eat a whole foods, minimally processed diet.
Amen.
Sweet. Awesome. Awesome. Okay, so on that note too, what supplements have you noticed that have made the biggest impact generally across the board to pretty much all of your patients?
Well, because the American diet is so processed, people are so nutrient deficient, even if they're getting some fruits and vegetables, because our soil's been degraded a lot. There's a few things. A multivitamin and mineral, high potency, one that's made with bioavailable ingredients, so your body will actually recognize and absorb it. Centrum, it's better than nothing, but a lot of those ingredients are hard for the body to digest and absorb. So that one's called Primal Multi. Really great, all bioavailable forms of all these vitamins and minerals, so you'll get a lot of benefit out of that. You'll absorb a lot of it.
Wow. Wow. So what specifically about this company and these brands makes you give them your seal of approval? What's the special selling point on all of these here?
A lot of these brands are only available through practitioners. So they're guaranteed potency. They do third-party testing on their ingredients. The amount of vitamins or nutrients you're getting them will have a therapeutic dose. Sometimes if you just get a generic vitamin, say from Walmart or Walgreens or something, it'll be a synthetic form of the vitamin that the body doesn't really absorb very well, or can actively interfere with your metabolism, or it just won't be enough. I see a lot of fish oils from Costco. People will bring in, what do you think of this one? I'm like, well, fish oil is great. The American diet, we need those omega-3s. They're very anti-inflammatory, good for the heart, good for the brain, good for the joints, but you got to get enough of them. If you take a tiny little bit of it, or if the amount of omega-3 in there isn't very high, you're not going to get much benefit.
Yeah, that makes sense. I've seen a lot of nettle and oat straw supplements, or I've seen things of that nature where there are herbs which you just need in such a larger dose that you can eat the entire bottle of capsules and you're not going to get the same quality of nutrition or nourishment that you would if you went and you foraged them and you made a huge nettles infusion or an oat straw infusion. So that's really important. And honestly, from a practitioner's perspective, that's a breath of fresh air to hear, because it re-emphasizes the fact that before you put something in your body, you need to know as many of the factors as possible: the quantity, the quality, and
the timing.
The timing, if it's even indicated for you. So that's pretty sweet. So what's up with this right here?
So this one, standard process. I really like this company. They're based out of Wisconsin. They grow a lot of the ingredients on their organic farm right there, like a stone's throw away from the processing facility, right? So you can pick up a rock and throw it at the building where they process it into the supplements. They're all whole food based, so the body recognizes it well, in most people, unless they're really, really sick. Plus, because a lot of their stuff is freeze-dried, you're getting super concentrated nutrients. So in some of their capsules, like their greens capsules, we're talking pounds and pounds of cruciferous vegetables, rather than, say, like the nettle that you'll find Nature's Way. It's just not very concentrated, so you need to take a lot of it in order to notice a difference. This one I like. It's 40 different fruits, vegetables, mushrooms, superfoods, because Americans don't get a lot of variety in their diet, and you need as wide a variety of foods as your body can tolerate, because it helps to train your immune system and the microbes in your gut to be able to digest and deal with a wide variety of different things. If you only eat 5 different foods, your body gets really good at digesting those 5 different foods, but then you introduce something new, and that can cause all sorts of havoc and inflammation.
Sweet.
Some of the other ones, let's see. Yes, digestive enzyme. Most of my patients can do something with a digestive enzyme, even if you don't want to take anything else. Even a digestive enzyme just helps your body break down and assimilate food more easily. So this one has pancreatic enzymes, break down fats, proteins, carbs, a little bit of hydrochloric acid in there. That's a stomach acid replacement. As we get older, our stomach produces a lot less stomach acid over time. So that helps to break down proteins. It also helps to sterilize the contents of your stomach, so those microbes, parasites, whatever, aren't getting into your lower digestion. Also has some ox bile in there to break down fats and support the liver. Vitamin D. Vitamin D is famous for being helpful for bones, but in all the research I've done in my master's program, we have receptors for vitamin D all over the body. It's good for almost every system. I guess that's why it's, nature's multivitamin. You go outside in the sun and you can get vitamin D, and it helps with so many different things. I give vitamin D to nearly every patient because we're in the Pacific Northwest. It's rainy and cold, clouds covering most of the year. So almost, I'd say 9 out of 10 of my patients are vitamin D deficient when we test them. So that can be so helpful to calm down inflammation, support the bones, support hormones, improve the skin, improves mood. In people that are deficient, it can even help their back pain. There's some evidence to support that, which is pretty cool. The last one is an omega-3. I really like this company because they make high quality, super concentrated omega-3s, so you don't have to take tablespoons and tablespoons of oil. You just have to take a couple soft gels to get that therapeutic dose. Omega-3s in the American diet, we don't get nearly enough of them. I'd say, again, 70 to 90% of my patients aren't getting enough omega-3s in their diet if they're not already supplementing, or they don't eat things like salmon, sardines, or anchovies every day. Because the grass-fed, wild game animals that people used to hunt, they'll have a lot more omega-3s in their bodies just naturally from their diet.
Because they're eating a lot of plants and a lot of things that have a lot of those omega-3 fatty acids, and they're transferring into their fatty tissues and their membranes and stuff, right?
Exactly.
Okay, sweet.
But if you're eating beef that was grown on a feedlot where they're just, giving corn and soy and things like that, they got a lot of omega-6s, but almost no omega-3s.
Interesting. Okay, so all this being said, the final question today, which is, I'm going to throw it to you off top. We're going to give you a curveball here.
All right.
What is the most significant change either to your health you've made or you've seen other people make that seems not scientifically validated, or it seems maybe like common sense that many people don't actually practice? Or like what is the biggest thing that you've seen make a major impact on people's lives that they don't talk about in school? What are some of the biggest things for quality of life that you find essential in terms of the average person's health practices, or even your personal health practices? What's outside of the books that's important?
Outside of the books.
And what's outside of the canisters? What's outside of the supplements? What would you consider to be essential for a great quality life that you can't buy with money?
That you can't buy with money. That is a great question. I don't know how out of the books this is, but something that's often overlooked, and we haven't really touched on it too much yet, sleep hygiene. How are you sleeping? Because if your sleep is crap, everything else is going to be crap. I can't tell you the number of people I've worked with that if we can improve their sleep hygiene, get them sleeping better, more deeply, get more of that restorative sleep, every complaint they deal with will improve. And if I have a patient with chronic issues, like I'm working with a gentleman right now, he and his wife, he's got some cognitive decline, memory issues, but he also has really bad sleep apnea. Doesn't wear his CPAP because he just finds it uncomfortable. So we're working on getting him a new sleep study and trying to find alternatives for him. But in the meantime, I'm trying to give him ideas like mouth taping, dimming the lights before bed, avoiding alcohol, sugar, not staring at a screen right before you go to bed, doing something relaxing like reading a book before you go to bed. Only use your bed for sleep and fun times. Don't watch TV in bed. All of those things are going to help his sleep hygiene, because until we can improve that, cognitive function, it's kind of a coin toss, right? Because if he's not sleeping well, he's not clearing out his brain, his body isn't getting that chance to rest, we're working uphill the whole way.
Yeah.
So.
Yeah, and that's where healing really does happen. You know, it kind of begins in the brain.
Yeah.
During the nighttime phase. So that's a big one.
Yeah. So make your room as dark as you can. Blackout curtains if possible. If you startle easily and you wake up a lot, get a white noise machine or a HEPA filter in your room that can make some noise to just drown out the sounds of the outside world. Dim the lights a couple hours before bed, and if you can, stay off a screen right before you go to bed. I know that's when a lot of people like to watch TV. If you are going to do that, keep the lights as dim as you can, or wear those glasses that help to filter out blue light, because that blue light that goes into your eyes prevents your brain from making melatonin, so it's much harder to even get down into sleep. How's that?
That's perfect. That's perfect. All right. Well, thanks, man. It's been a pleasure.
Thanks so much.
Sweet.